Hey everybody, welcome to my channel. My name is Amber, and today, I don't know why I say Amber like that. Amber. Anyway, today I'm going to be doing a video about having a gentle C-section. So I'm just going to talk a little bit about some of my options for birth and some of the things that I talked to the doctor about the other day, and just hopefully have a plan on how this C-section is going to go down. So last week I went to see my high-risk doctor. You guys may or may not know, but I'll make it quick. I have a mass in my spine called a cavernoma, and it started to bleed. I was 21 weeks when that happened, and it bled into my spinal cord and caused all kinds of weird, funky nerve problems. I couldn't lift my arm. I still have numbness on this side of my body. So before that, I was delivering at the birth center, planning on doing an unmedicated hypnobaby, water birth, all that jazz. Since all of this happened, that got shot straight out the window, and now I am delivering at a big hospital with a high-risk team, and the surgeon doesn't think that I'll be able to push. So next option is a C-section. So I am waiting to hear from the neurosurgeon and the anesthesiologist. I go see the neurosurgeon next week. I have to have another freaking MRI, but that's okay. So we're just kind of waiting to see if I can have an epidural during my C-section, or if they're going to have to put me out under general anesthetic. So that is the dilemma. But anyway, last week I went and I did talk to my doctor about having a gentle C-section and just about some of the things that I can do that'll still make me happy while having to do something that I don't want to do, which is a C-section. So some of the things that I asked her, I don't know if you guys have heard of a gentle C-section, but some hospitals are getting on board with this. And if you are having a C-section for any reason, these are some things that you can talk to your doctor about and see if they are willing or open or okay with doing. I was really nervous to ask about some of these things just because I thought, oh, they're not going to be open to any of these ideas. But I was pleasantly surprised that they were open to most of them. So even if you plan on having a vaginal delivery and for some reason you end up having an emergency C-section, you know, or whatever, you can have these you should still have, well, you should look into it, having a birth plan. And on your birth plan, you should also have a section for in case you have to have a C-section. There's just definitely lots of things that you can do to still be able to be in control and have the birth that you want while not being in control at all, because you have no control over somebody cutting into you. So, so some of the things that I asked was during the C-section, if I could be given just, I didn't ask this yet, but I'm going to. This is one that I forgot. I want to see if I can just be given the pain medicine, and I don't want all of the calming, I don't want my mood to be changed. I want to remember everything. I don't want to be lethargic. I don't, you know, I want to remember it all. I don't want to feel the pain, of course, but I want to remember it all. So you can ask the anesthesiologist if you can just have the pain meds and not have the stuff to calm you down and, you know, to make you feel calm and collected. So anyway, I'm going to ask if I can do that. Another thing I did ask about was if I could only have one arm, because sometimes they'll strap down both of your arms during surgery. So I did ask if I could only have one arm strapped down, and that possibly the little sticky things, you know, they put on you, can be put on your back so that whenever the baby does come out, you can have immediate skin to skin. So I asked if that could happen. They said yes. I asked if I could have immediate skin to skin. Obviously, as long as the baby's okay and I'm doing okay, then of course we can do immediate skin to skin. So I was excited about that. I did ask if instead of the blue drape that's going to be in front of me, covering all the mass blood stuff happening down here, that instead of the blue one, if we could lower it whenever they're pulling baby out, or if I could have a clear one, that way I can see what's happening. So I definitely want to see I want to see my baby being born. So I did ask about that, and she said she wasn't sure about the clear drape, but they definitely can lower the drape so that I can kind of see what's happening. So that was exciting. I asked about delayed cord clamping, something that they regularly do during vaginal deliveries at the hospital I'm going to, but I didn't know what they would do for a C-section. So she said that's definitely not a problem. Once again, obviously I know this, but once again, as long as baby is okay and not in distress, they will delay the cord clamping until the umbilical cord stops pulsing. So if you guys haven't heard of this, it's becoming more and more popular in hospitals, more of a routine thing, but just delaying the cord clamping will ensure that your baby is getting its full blood volume, you know, before they cut that off. So that's important to me. So they will do that. What else? Oh, the skin to skin. I even asked if baby is interested in breastfeeding while they're still stitching me up, if that was a possibility. And she said, sure. If the baby's showing interest, you can go ahead and breastfeed there on the table. So that was good. And then I wanted to make sure that when I went to recovery, my husband could be with me and that the baby could be with me the whole time, and then I could hold the baby. And she said, yes, definitely. So they didn't say no to anything, so I was really pleased with that. So depending on what the neurosurgeon says, it sounds like almost 99% we are doing a C-section. And depending on what the surgeon says, we will see if I can be awake, which I'm praying to God that I can, so that I can witness the birth of my baby. But I was really happy and pleased that all of these things they would allow me to do. Because like I said, the little things, it's going to be all the little things that make me okay with having to do the C-section. So, so there's that. Oh, and they also said that I don't want the baby to be wiped off or anything. I mean, they can be wiped off a little bit, but I don't want them, like, I don't want the vernix cleaned off. So she said they already delay bathing 24 hours, and I'll probably delay it even further just because I really want to make sure that they get the full benefit of the vernix, and I don't want to wash it off right away. So, so that also made me happy that I don't have to keep an eye on them and make sure they're not going to go take the baby and bathe it without asking me. So, so all of that was just really good news. I was really happy about it. So let me know in the comments below if anybody has had a gentle C-section, if you've heard of it, if this is something that you would ask your doctor about. I think there's definitely options, and I still will have a birth plan even though I'm having a C-section. I want everything documented so that they just know this is what I want. So, and I think it's just important to know that you still have choices, you still have a voice, you can ask questions, and you definitely have to be an advocate for yourself, because if you don't ask any questions, they are just going to do what, you know, they're just going to do what they normally do, and it may not be something that you're okay with. So, ask questions. So, anyway, thanks for watching, and I will keep you guys updated. Bye!